I have used these plates and it's very efficient, and the chances of having a chest infection is less. It's a surgeon friendly also, is a user friendly, as well as it gives more benefit to the patient. I'm Dr. Pramod Reddy Kandakure. I'm the Clinical Director in Cardiothoracic Surgery, Care Hospital, High Tech City, Hyderabad. Today, I'm going to discuss about a system, which is a new system, which is established, very well established, but we have modified the system and it is well available in India. That is called Euthesia system. This is what it is there, Euthesia rib plating system. So, what are uses of this system? I will discuss with you in detail now. So, as you know, this is thoracic cage, and these are the ribs, this is sternum. So where is it, especially in cardiothoracic surgery normally when we do cardiac surgery, either we go from cutting the breastbone or we go through the ribs. So that is one part of the cardiac surgery where we can use these ribs when the sternum we are not able to close properly, or there is a fracture of the sternum. When we do the surgery, we can use this system. The plates we can put it and gives a more strong support to the sternal bone. So normally we use we use wires to fix the sternum, but we can use these plates, and I have used these plates and it's very efficient, especially when I take the bilateral mammary artery where the bone vascularity is very less, and then chances of wire cut through sternal stability is more in these cases. That is one thing. The other ones where we commonly use is the fracture ribs. So any polytrauma or chest injury is there, so when the fracture is there, we can use this system very well. And this system you can mold it, and according to the curve of the ribs we can do it, and then we can fix it. These are the locking screws. We have to drill it and then fix it with the screws, so it gives a stability, and then patient can be mobilized very faster, and the pain also will be less. So if the pain is less, the patient will breathe better, and the chances of having a chest infection is less, and the lungs get expanded very faster. So if you see the difference in previously we used to manage these rib fractures conservatively, that is just bed rest, pain medication, chest binder, and if you do this system, you can make the quality of the life changes. So the patient feels much better, more comfortable, there is less pain, and the patient can be mobilized much faster, and less chances of infection. Lung is expanded, there is no chance of having a hemothorax in the future. So that is one system. This system we used. So there are how we use it, it depends upon the thickness of the ribs. So the screws, the depth of the screws, we gauge the depth of the screws after drilling, and then there are 8mm, 10mm, 12mm screws are there. Accordingly we put that screws accordingly, and these are locking screws, so the plates are not moved when we fix it. So we reduce the fracture, and then we fix the plates after the molding the plates, and then we put the screws. So it gives a very firm fixation. So it's same like ortho, they do it, but in ortho it's a long bone fracture, but here if you see the ribs, the moves every 16 to 20 times it moves in each breath. So it's a very painful compared to any other fracture. So I recommend all patients or all doctors to fix the ribs as far as possible. So at least even if you are not fixing the ribs complete, if you don't want to fix all the fracture ribs, at least the displaced ribs has to be fixed. Plus whenever the flail chest is there, that is very essential, or it's must to fix the ribs. The other uses of these ribs are like when we excise the rib, when the tumor is there, we can excise the rib and then put a plate. So it gives a support, and then it gives a support to the ribs also, as well as the breathing mechanisms is improved because of this system, and it helps in the breathing mechanism, so the lung expansion and chances of infection is less. These ribs are biocompatible, and we don't have to remove these ribs in the future. So once we placed it, there is no need to remove. It's biocompatible, so it doesn't give like foreign body reaction or inflammatory response to the body. Plus when we do the tumor excision of the ribs or something, so when we excise that ribs, 2 or 3 plates two or three ribs also we can excise, and then put the plates. So it can be used anteriorly, posteriorly, and laterally also we can use this rib system. So but we have to mold it according to the curvature of the ribs. So there are different types of rib plates are there, like so some are like pre-molded are there, and some are like standard or universal plates are there. So accordingly we can use those ones. So if you use these rib system, this is very good system, and I have been using this for quite long time, and I am very happy with this system. It's surgeon friendly also, is user friendly, as well as it gives more benefit to the patient.